there's a lot of people, at least in my mind, who had coronavirus before we were testing, got better, think they had the flu, and have never been tested, i.e. there's a whole bunch of people who have recovered that we'll never know about. Is that a fair assumption on my part?
Absolutely. And there are people today who aren't being tested. They don't think they have it. They have some mild symptoms. And so we know that the numbers who have it and have recovered are going to be a lot higher than we know.
So basically, and I'm trying to explain this to my brother yesterday, hell, what you said to Aaron, what we said to Aaron on Friday. How long is this going to last? It's up to you. It's really, at the end of the day, up to the person who might become a patient to look out for themselves more than anything else, right?
That's right. I'm going to get on my soapbox for a minute, if you don't mind.
Please do.
Please. So what everyone should be doing right now is considering themselves as a positive case and considering everyone around them as a positive case. If I have it, I don't want to give it to anyone else. If they have it, I don't want them giving it to me. We need to be responsible. We have a duty to this society to do what is right. And we know what is right. The governor is telling us to stay home, to be out as little as possible. If your job is essential and you have to go to work, to please be mindful of your behavior and how you're interacting with other people. And people are ignoring those requests. And that's shame on them. Shame on them. If you want to see this end, you're going to have to be responsible and make your children be responsible, make your parents be responsible. And we could see it end in a relatively short period of time. But we have to do the right thing.
I hear the frustration in your voice. I hear the president and others talking about the need for more medical equipment. Are you hearing that same frustration from medical staff? Are we getting to that point in your region where medical equipment is now in short supply?
So right now, I believe that people have what they need, but the fear is how long is this going to last and how many people are going to be sick enough to be in the hospital, which requires multiple gowns and multiple masks per patient per day. So their fear is, how long can I handle this and how big is it going to get? And so they're looking around for other sources of PPE. And we have really, as a community, come together to see how we can meet their needs as well as reach up to the state and reach even up to the feds. And we have gotten PPE brought into the state. So I'm hoping that we'll see a continual flow. Right now, I think we're okay, but we're on the edge of it, you know.
The healthcare workers, your co-workers, did they urge the governor to issue the order he did yesterday? And how soon could we see it work and have an impact?
So we know that people who are out there who have been exposed, you know, they're incubating and they could come up with this virus in the next 14 days. So starting from now, we could really see it go away in the next few weeks if we start paying attention and staying in. As far as urging, you know, the state health officer, Jimmy Guidry, who is my big boss, and Frank Welch, who is a medical director in the Department of Public Health, they have been speaking, and Dr. Bu, who's the head of public health, they have been meeting with the governor multiple times a day. And so these things they're not issued lightly. He knows the consequences and he takes them so much to heart. Everybody is afraid. Nobody wants to lose their business or lose their income. But the more we pay attention, the shorter time that will be.
Should we stay at home during the hours that even essential workers, that they're not on the job? Should we remain at home unless there's some sort of emergency or a necessity that we have to have?
Yes. The less you go out and are around other people, and when you're at home, the more you have, it doesn't mean you can't be in the same room with your family, but the more you pay attention to those social distancing cues, because it is infectious. So we want to make sure that even when you're at home, that you're paying attention, that you're cleaning a lot in your home, you're wiping down your surfaces, thinking about things people touch all the time, light switches, door handles, toilet flush levers, all the countertops, everything we're touching. We want to do all those things so that we can limit the spread. And I do think if we do that, we'll see a difference.
Dr. Martha Whyte, Office of Public Health for Region 7. Thanks for your time this morning, and sorry to bug you so often.
Talk to you tomorrow. Thank you, ma'am.
Thank you. Y'all have a good day.
Thank you, Doc.
Just call us when you're free. We won't bug you anymore. Thank you, Dr. Martha. Great stuff as always.